Hello, my name is Brian Larson, and this is my global health presentation on dengue. This is a picture of the dengue virus-carrying mosquito. Note the long black legs with white stripes. Its scientific name is Aedes aegypti. Dengue is a global problem. Infestations occur in areas where temperatures do not change drastically throughout the year. This is why we see it in the more temperate and tropical climates. Areas of highest infection rates are mostly developing countries. With limited resources, these countries struggle in combating the spread of the virus. In this graphic from the World Health Organization, we see an average number of reported cases being above 100,000 from the years 2010 to 2016. This is grossly underestimated because countries with the lowest resources didn't participate, such as Africa. This is an example of how difficult it can be to get an accurate number of cases per year. According to the CDC and WHO, there are about 50 to 100 million infections of dengue virus per year. Of those millions, 500,000 will become severe and 22,000 will die. The dengue mosquito likes to find standing water that is shallow. It lays its eggs and after about 10 days, new mosquitoes are born and emerge from the water. This is one of the greatest difficulties in stopping the spread of the virus. Water finds hiding places in all different types of vessels. New studies have discovered that despite community knowledge of prevention, there are still places people are not paying attention to. Here is a picture of an Asian religious urn or vase that is found in temples all over Asia. Also, religious flower pots or other vessels were left undisturbed in Cuba, leaving a perfect spot for the mosquitoes to breed. The following slides are ways we are combating the spread of dengue today. The first way is the most primitive. By using insecticide, we can combat the spread of mosquitoes by directly killing them. Unfortunately, it is found to build resistance within the mosquito, and it damages humans and the environment. Here we see a graphic showing the process of introducing Wolbachia bacterium infected mosquitoes into a local population of the dengue-carrying mosquito. An amazing discovery was made when scientists saw that mosquitoes that had this bacterium were unable to transmit the dengue virus. By infecting the eggs of the mosquito with the bacterium and then introducing the new Wolbachia-carrying mosquitoes into the environment, over time, the population of mosquitoes in that area would be unable to transmit the virus. Unfortunately, there have been barriers to carrying out this new task. Apparently, people have not enjoyed having containers full of mosquitoes released where they live. One study in Queensland, Australia discovered many barriers and has helped the Eliminate Dengue campaign understand how to get buy-in from the local community before releasing the Wolbachia-infected mosquitoes. Another form of combating dengue has been through researching vaccines as a form of primary prevention. This pharmaceutical company, Sanofi Pasteur, created the vaccine and got it approved in many different countries. Unfortunately, things didn't go as planned, but before I tell you why, we need to understand something about the pathophysiology of the virus. Dengue symptoms can be categorized in the simplest of terms into mild and severe. With mild, we see headaches, pain behind the eyes, nausea and vomiting, high fever, rash, flu-like symptoms, pain in joint and muscles. With our severe symptoms, we see that we can experience shock, severe bleeding, severe vomiting, pain in the stomach, and blood pressure drops. It's important to understand that the likelihood of severe dengue increases with secondary infections. In the Philippines, it was found that those injected with the vaccine basically acted as a first infection, making their first real infection of the virus act like a secondary infection, resulting in severe dengue symptoms. This in turn made the vaccine banned by the World Health Organization, and the companies Sanofi Pasteur forced to recall their product. Most countries have since banned the use of Dengvaxia vaccine. The following are slides for nursing implications. Here we see very basic treatment for the dengue fever. Since there are no cures, it is important that our patients drink plenty of water to avoid dehydration, get plenty of bed rest. They can take acetaminophen to reduce pain and reduce fever. It has also been found that research does show that papaya leaves extract does increase platelet count, this being an issue with the virus targeting those platelets. It has not yet been found that it helps with dengue, but there needs to be higher quality research in order to truly understand if it does. But it has shown to increase platelet count. Because the treatment is so simple, it is important to monitor the patient closely. Because they are at risk for bleeding, taking blood pressure and checking capillary refill time is a must. Here's an example of capillaries bursting, causing a rash-like appearance. This can happen anywhere on the body. As stated before, dengue is a global issue. This graphic shows that the problem is only growing. In a massive collection of 70 years of data, it is mapped out that the 4 different types of dengue, which are the DE and V1 through 4, are spreading, showing no signs of slowing down. With problems such as ineffective vaccines and population control strategies, as seen before, it is easy to see why this graphic is telling the truth. An important note is that there are very simple ways to help anyone wanting to go to these countries stay safe from the mosquito. Insect repellent with DEET is effective. Mosquito nets are perhaps the best form of prevention, and if you are feeling adventurous, you can buy a bug shirt. I want to thank you for listening to what I have learned about this great epidemic. I have personally been diagnosed with dengue when I was living in Brazil as a missionary. I felt the pain in my bones and breathed in this insecticide in the streets. I understand that this infection is a huge problem, but with knowledge and prevention, there is no need to fear.